Welcome all. We will be getting started shortly. We're just waiting a few moments to let folks in and to get settled. Thank you for attending the first Community Living Equity Center webinar, Disability, Identity, and Pride in Equity Research. Within our title page, we have an image which includes 4 individuals with disabilities of varying conditions. One with crutches, one who offers prosthetics, one individual who sits in a manual chair, and then one individual standing ambulatory, having a service dog with a vest. We are so excited for this webinar and look forward to having an interactive discussion. Next slide, please. In order for all attendees to enjoy the content of today's webinar, we would like to outline a few accessibility features. One is by clicking the interpretation icon, you will be able to access and see live ASL interpretation. And by clicking the CC icon, you will enable Zoom closed captions. Both of these icons are located within the meeting control bar. We will offer a moment for folks to enable their needed accessibility. Next slide, please. Our work within the CLEC is funded by the National Institute for Disability Independent Living and Rehabilitation Research. The CLEC receives support from the National Institute on Disability Independent Living and Rehabilitation Research, also known as NADLR, within the Administration for Community Living, the U.S. Department of Health and Human Services. The content of this webinar do not represent the policies of NADLR, ACL, HHS, and you should not assume endorsement by the federal government. And the opinions shared today are the perspectives of our distinguished panelists and do not reflect the opinions of our funders. Next slide, please. It is such a joy to be with you all within this virtual space. I see that folks have begun to introduce themselves and say where they're from within the chat. Please continue to do so if you have not already. We are surrounded by so many amazing advocates and leaders within both research and the field of disability services, and we're excited to conduct this webinar today. For those that know me, thank you for being here. And for those that may not know me and may be new to the work of the CLEC, welcome. My name is Jennifer Lee Rambaros. I identify as a Black woman with physical disabilities. I am brown skin, have a twist in my hair on the right side of my hair, leading into a puff bun. I'm wearing a blue shirt with white polka dots and a black cardigan sweater. I proudly identify as a member of the disability community and was born with a physical disability. Previously, I served in the field of human service for over 10 years within the areas of advocacy, program management, and grassroots organizing. To my work within the Lurie Institute and the CLEC, I lend perspectives on disability justice and intersectionality. These perspectives inform my work as project coordinator of the Community Living Equity Center. Today, I will be leading our discussion and serving as your moderator. I'd like to give Teresa, the director of the Community Living Equity Center, an opportunity to introduce herself as well.
Thank you, Jen. Good afternoon, everybody. My name is Teresa Nguyen. A quick visual description of myself. I am an Asian woman with long black hair. I have a pink t-shirt on and I'm sitting in my power wheelchair. I serve as the director of the Community Living Equity Center, and my disability identity and pride shapes my work every day by incorporating and honoring the lived experiences of my disability community in all aspects of our center's work. Jen?
Thanks, Teresa. Now that we've had an opportunity to introduce ourselves, let's move on into the webinar objectives and agenda. Our objectives for today is that attendees will develop a shared understanding of how the CLEC intersects with disability pride. We'll discuss existing barriers and reflections of disability identity within research, and learn from members of the CLEC Community Advisory Committee about disability pride, identity, and culture, and how researchers can better engage persons with disabilities of intersecting identities within research. Our agenda is as follows. First, we will start with CLEC overview and mission to acclimate you to our work within the CLEC. We will then address data disparities within LTSS research. We will then move into our panelists and our Q&A, in which we're hoping to have immense attendee involvement. So we hope you look forward to engaging with us through chat. And then lastly, we'll end with some closing remarks about how you can continue to be informed with our work within the CLEC. Thank you. The goal of the Community Living Equity Center is to address gaps in knowledge about inequities in community living and participation, experiences, and outcomes faced by disabled people of color, and develop interventions to address equity by leveraging existing and new data sources, developing new policy and system change initiatives, and provide active dissemination of findings and trainings for stakeholders. Within the CLEC, our work is supported by three major aims. The first is to generate detailed new knowledge about community living and participation disparities. Our second aim is to develop new or locate available system change initiatives or other promising practices for reducing community living and participation disparities. And our third and last aim is to serve as a national resource for the conduct of disability and rehabilitation research in the community living and participation domain that is inclusive of people with disabilities from traditionally underserved communities. Next slide, please. Just as a note for accessibility, we will be pausing between slides to allow opportunity for individuals to interpret the content of the slides and to allow our interpreters to be able to interpret. We thank you for your engagement and for your patience and participation. Those aims help to support our work within the center. And our team has many areas of expertise that aid us in support of these principles, including community organizing, federal program oversight, research, and of course, our lived disability experience. Disability pride is present within our team, and the principles of this center are rooted in the belief that disabled people of color are experts at their needs and vital to determining recommendations for services, programs, and systems change. Our center has 5 guiding principles. Those principles are included on the slide, and I will be reading them. First principle, disabled people of color with LTSS needs face significant barriers in access to HCBS and culturally and linguistically appropriate services. Disabled people of color with LTSS needs are the experts at what they need. Disabled people of color with LTSS needs have intersecting identities that comprise their lived experiences, and particularly their experiences within the HCBS service and delivery system. Disabled people of color with LTSS needs must be meaningfully involved in all aspects of research and knowledge translation activities. And lastly, disabled people of color with LTSS needs must be in leadership positions and receive capacity building and mentorship opportunities related to community living research, advocacy, and service delivery. Next slide, please. Teresa?
Thanks, Jen. Before we hear from our awesome panelists today, I want to highlight a little bit of some of the current challenges in the data that researchers face when we are looking at race and ethnicity disparities in Medicaid home and community-based services. So we know that existing data truly fails to recognize the differences by race and ethnicity in the prevalence of long-term services and support needs, the race and ethnic disparities in access to and utilization of the Medicaid home and community-based services. And we also fail to recognize disparities in access, utilization, the barriers and facilitators that folks of color with disabilities experience in accessing home and community-based services. Existing data also makes pretty limited reference to racial and ethnicity differences in the use of self-direction and the impacts on community living outcomes for disabled people of color. And this makes it pretty hard for all researchers to address equity and improve access to home and community-based services and community living outcomes for disabled people of color. We know that literature also does not adequately speak to race and culture considerations and how these identities might impact services and utilization for folks with disabilities. Next slide, please. So how does our center seek to uplift disability, culture, and identity within our research? Our entire center, from research to information dissemination, is guided by our advisory committee, made up of individuals with lived experience and other intersectional identities. A lot of our studies use a community-based participatory research approach where the studies are disability-led, with individuals with lived experience implementing all research steps, including design, data collection, and data analysis. We also have a very diverse and cohesive dissemination partner network who will help us when the studies are complete to share the results of the study and additional information with a larger community. Next slide, please. Jen.
Thanks, Teresa. We cannot discuss the work within the CLEC without speaking to the national perspectives of persons with disabilities who help to inform all levels of our work, and also our amazing dissemination partners that will aid in helping us promote our work within the center, as well as share study findings to reach diverse communities of persons with disabilities, families, advocates, as well as policymakers. These findings are findings within the center will center around the perspectives of persons with disabilities who are of color. Our dissemination strategies are wide and include a diverse array of strategies, including engaging through our website and Spanish sister website, offering plain language briefs, research briefs, which explain our work, presentations, and of course, engaging with you all through future webinars. Our engagement with the community is supported by our commitment to uplifting participatory leadership of disability organizations and individuals with disabilities, and fostering true collaboration with disability and aging advocacy organizations and coalitions, including our Disability and Aging Collaborative and our very own Community Equity Advisory Committee. Next slide, please. This committee, our Community Advisory Committee, consists of national diverse representations of persons with disabilities and advocates. Members hold a variety of intersectional identities and are representative of many different groups. Individuals identify as being Black, LGBTQ, Native Indigenous, Latinx, as well as other intersecting identities. Fostering trust among this committee has been of great importance to us within our center, and we believe is vital to helping them be able to support as well as inform our work within the Community Living Equity Center. We hosted a lunch and learn for individuals of the advisory committee to get to know both myself and Teresa a bit better, as well as learn about our objectives or ask any questions that they have in regards to the CLEC. And keeping with our commitment of wanting persons with disabilities involved in all phases of our research, we are proud to announce that we placed a call for a national logo competition in hopes that artists with disabilities from around the nation would submit examples and imagery of what they believe community living equity represented. Our Community Advisory Committee reviewed all submissions and also engaged in a vote. We are proud to announce that the CLEC logo was selected and designed by a member of our advisory committee, Tyree Brown. This logo can be found within this PowerPoint on our website and in all CLEC materials. An honorarium was given to the logo winner in exchange for the design. The advisory committee is vital to the CLEC, given they also aid in the review of draft study materials, inform study design, and also will aid in dissemination strategies. It is a pleasure of ours to uplift the perspectives of 3 members of our advisory committee. And all members of our advisory committee receive an honorarium for their participation. And those engaging in our panelists today will receive an honorarium as well. Each of our panelists will reflect their perspectives on disability, identity, and pride, and how research can better engage and reflect diverse perspectives of persons with disabilities. Each panelist will have an opportunity to introduce themselves briefly, and then we will move to our interactive panel. We encourage you, our attendees, to engage with us throughout the duration of this discussion, as well as ask your own questions through the chat and Q&A. So let's get into the exciting part. Let's begin to engage our panelists. Let's get started. Janie, can you please introduce yourself and provide a brief image description?
Sure. Thank you, Jennifer. My name is Janie Mejias. A brief image description. I'm a white and Hispanic woman. Today I'm wearing a black button-down shirt with flowers, and I'm seated in my power wheelchair in my office, home office. I work for Women Enabled International, and I'm also a scholar, a gender and disability scholar.
Thank you, Janie. Germán? Germán, I think you're muted. Thanks. Feel free to introduce yourself and provide an image description.
This is Germán. Can you hear me now?
Yeah.
Thank you. Sorry about that. My name is Germán Parodi. I use EL pronouns. I'm the co-executive director of the Partnership for Inclusive Disaster Strategies, the nation's disability-led disaster hub, and I'm joining from Philadelphia, the unceded land of the Lenape people. I am a Puerto Rican man wearing a black button-up shirt. I have long brown curly hair pulled back today. I'm wearing glasses and I'm sitting in my wheelchair. Behind me, you see a blue floral tapestry and a desk. Good to be with you all.
Thanks. Andy?
Hi, my name is Andy Arias. I'm Latinx, queer, and disabled. I have a gold sparkly background. I have gold highlights and wearing a dark mustard colored shirt. I am a national disability policy expert, as well as work on disability, equity, and inclusion for Georgetown University. And I'm coming to you from Los Angeles, California.
Thanks, Andy. Now that everyone has had an opportunity to get to know our panelists a bit better, let's move into our first question. Andy, we're starting with you. How does your involvement in the CLEC represent disability pride?
Disability pride is a very deep, meaningful thing to me. My involvement in this group is so important because not only is it led by individuals with disabilities, but every piece of policy deliverable aspect of the work is also disability led. Oftentimes, we as individuals with disabilities get told, or I like to say able-splained, about our needs and services about the realities of our lives and what our lives will entail, how research will be developed by non-disabled or temporarily non-disabled people. One of the things that drives my efforts in this group is the fact that it is really diverse, and it is also all disability led. I think that a lot of the time, individuals from disability experiences are typically viewed from a white lens of disability and checked boxes. And so me coming into this group and meeting all these wonderful people from diverse backgrounds, this center is actually rolling the walk, as many people like to say, and actually starting from the beginning and not just sprinkling disability, equity, and inclusion at the very end and saying we're equitable and we're trying to do the work. In general, they're not using DEIA practices as a sexy term, I like to say, and really putting it at the beginning, middle, and end. And so it really gives me a sense of hope and a sense of belonging for the future, for our entire community, because we're actually working together to move the needle. And I think it's one of the first times I've seen a center really do this work in a disability-led space that is moving the needle so vigorously for research and deliverables.
Thanks, Andy. So I feel like I'm hearing you say that like representation matters within the research space. Thank you for that perspective. We'll come back to you soon when we open it up for more questions. Next, we're going to move to Janie. What do you think researchers need to know about disability, culture, and identity of persons of color with disabilities?
Thanks, Jennifer. I think it's really important for researchers to understand that people with disabilities, especially people of color and other multi-marginalized people with disabilities, we have consistently been asked to give up portions of our identity when engaging in disability rights movements, movements related to race and gender, etc. And, you know, that is hurtful in a lot of ways because all parts of our identity are extremely important to who we are. And we don't want to compromise or emphasize one part of our identity over another. So being able to claim proudly all of the identities that we have, I think is really important for researchers to keep in mind when crafting research. Also, I think it's important to keep in mind, as Jennifer was saying, one of the objectives of the center is to make sure that people with disabilities, especially multi-marginalized people with disabilities, are included in all aspects of the project. A lot of times people with disabilities are brought in at the end of a project or maybe at the beginning of the project to get some ideas, and then able-bodied researchers take the lead and go forth with the idea without having guidance from people with disabilities throughout the project. And that really is a problem because our voices are not being captured in a meaningful way. And our priorities are being sidelined when that happens. And so having people from the very beginning, from when you're starting a research question, having people with disabilities, especially multi-marginalized people with disabilities, in the drafting of the research questions. What is important to us? And the design of the research methods, the data collection. It's often really important to have people with disabilities in the data collection phase, because when we're collecting data from other people with disabilities, there's often a lot of mistrust because we've been historically hurt by research, and there's been some harm. And so there might be mistrust. And so when the research is led by, when the data is being collected by members of the community, it often fosters trust and not only is empowering, but also, enhances the level of the data that is collected. So I think that is really important, and also to meaningfully compensate people that are taking part in research. Historically, people with disabilities have been asked to volunteer our time and expertise to take part in research activities and different things, and we don't get paid for it. And so it's really important that if you do have the funding, and also when you're seeking funding, to write it in your proposals that you will have X amount of dollars designated to your participants and meaningful compensation. So more than like a $20 gift card if you're asking them to put hours of work into something. And so that takes a significant amount of funds. So it's a good idea to put that in your proposals to funders and explain why you're doing so and why it's so important. Also, I would say it's really important to learn the distinction between disability rights and disability justice, and understand that distinction well. There is a distinction. Disability rights has historically been led by white male wheelchair users, and it wasn't intersectional at all, and the voices of multi-marginalized people with disabilities were not included in that movement. And so the disability justice principles really takes a lot of steps to make sure that the voices of multi-marginalized people with disabilities are at the forefront of the movement very intentionally, oftentimes from the beginning. And that is a very important distinction to keep in mind. So familiarizing yourself with that distinction is paramount. I think that's it on my end.
Thank you, Janie. So many amazing points around fair compensation, meaningful representation, meaningful engagement of persons with disabilities within research. Thank you for sharing your perspective. Germán, we're going to move to you. What is lacking in the research landscape?
Thank you for the question, Jennifer. And Janie and Andy have well touched on this topic. So you'll hear some words already mentioned. But as Janie was just mentioning, and Andy did begin to touch on, research needs to include people with disabilities from the onset as you're preparing your applications to grants or the funding source, and centering people with disabilities throughout all phases thereafter with compensation. Research needs to be available and easily accessible once it's released, not behind paywalls, and be accompanied by plain language versions as the CLEC is doing. We need research that recognizes our intersectionalities. We are people with disabilities, and we are also members of many other communities. Our gender and orientation, our color, our religion, our practices. We are not only people with disabilities, we come with intersectionalities, and recognizing and elevating all who make who we are is critical. There needs to be research on disability pride. How are we going to educate the research field about what it is without comparable documents? There needs to be more. And how will we get home and community-based services to all who need it? We need to have updated critical tactics and best practices on how to provide what supports so many become independent with disabilities. And recognizing that not everyone can access home and community-based services because it's a Medicaid program. So how are we going to support all people with disabilities with the long-term services and supports they need? Because of the field of work that I focus on being disaster response, preparedness, and recovery, there's also research missing with, well-founded understandings that are peer-reviewed on the impacts of heat on people with disabilities. What are the best practices that disabled people with different functionalities can implement, learn to survive different types of disasters? We need a understanding of how to maintain our health when we have to evacuate state lines. So many people with disabilities, as been mentioned, use home and community-based services. But when we have to evacuate across state lines during a disaster, we lose Medicaid benefits. So how will we maintain our health and independence if we have to cross state lines are topics that we need more information, more research on. And our siblings and institutions during disasters are often relocated when the building structure is damaged. But oftentimes, even families are not informed until much after of where they are and are their needs being met. We need research to open that can of worms truly and provide a spotlight on how we can replicate disability pride and that new disabled people can understand it, how we are going to support everyone that needs home and community-based services to access it, and how are we going to survive disasters, keeping and maintaining our health, ensuring that our siblings and institutions are receiving the services they need and not marginalized because no one's looking, and how we will prevent institutionalization in disasters of people with disabilities.
Thank you, Germán, for those points. I heard references to engaging persons with disabilities early on within research, centering the perspectives of persons with disabilities, providing findings in an accessible, easily digestible way, and then also outlining best practices, things that work well for persons with disabilities, as well as engaging things that may be necessary for their overall health, wellness, survival, such as disaster planning. Thank you for that. So in this next segment of our panel discussion, we will be framing questions for the panel in which all three of our panelists have an opportunity to respond if they would like. And then we'll move on to our Q&A. For those that are joining us, please continue to engage with the questions via chat. Your perspectives matter to us as well. And so let's get started. First question for the overall panel. When thinking of your intersectional identities, how can researchers better engage with members of your communities?
I'll jump in quickly.
Thanks.
I think that members of my community, Latinx, queer, and disabled, need to see themselves leading the work, right? So often, and I alluded to this earlier, so often we have white saviors or white individuals opening our doors and saying, you get to be at our table, you get to be included. And then we're supposed to have this immense gratitude for just being at the table and listening to us for 2 minutes. And oh my gosh, thank you. But really, researchers need to know if they bring us to the table and make us the leader of the work, because we are the subject matter experts of our own experience, backed up with the work, that the research in itself will be so much richer. And then you're already framing it around equity. You're not just saying, bring in that Latinx queer person to talk for 5 minutes, and then we've done our job. You're saying this Latinx queer disabled person is leading the work, and this is how we're going to penetrate that community, because there's that trust level built and moving forward. So that's how I would navigate this piece.
This is G. Oops.
Yeah, go ahead, Janie.
I agree 100%. And I also want to say that any researchers doing work on disability need to have a clear understanding of how disability is defined in terms of social and cultural model of disability, and not from a medical perspective, because that is a medical definition of disability is very oppressive and harmful in a lot of ways. And so it's important that researchers understand the history of that, and understand that disability for a lot of people with disabilities, and some people with disabilities, still have a very medicalized understanding, and that's fine too. But for a lot of people within the disability community, disability is an important part of who we are. It doesn't have a negative connotation. And it's a prideful part of human diversity. And so, research really needs to focus on that aspect and steer away from the medical model as much as possible, because that is a very oppressive lens to look at disability. That was all I had to add.
Thanks. Germán, I saw you on mute.
Briefly, in full support of Andy's and Janie's statements, involve people with disabilities that you're doing the research on, where they are. Go out, meet them, reach out, be thoughtful about it, and center our opinions. Don't disregard them. As Andy was saying, don't just check the mark, but follow through.
Thank you all. Moving on to the next question for the full panel. In what ways can research better reflect the experiences of persons of color with disabilities? Andy?
I wanted to wait and give people the opportunity to jump in before me. I think a lot of what's for this question, I think a lot of it has been answered. But additionally, know that people of color and people with disabilities come from a different place. That's the baseline. We didn't grow up with privileges and opportunities that you did, right? Or that white cis people have. And so for us, a lot of us grew up in systemic poverty. A lot of us grew up on benefits and continue to utilize those benefits. A lot of us don't want to be on benefits our entire lives, and there needs to be a way for us to move beyond poverty without losing our services and supports. So these are all aspects of the intersectional of our lives, and disability, right? And I say and because many times people just look at the disability and want to triage that, but they don't look at the other aspects of our culture, our Latin culture, the fact that we've been oppressed as individuals from the Latin community because we're not equal. The fact that the queer community oftentimes doesn't look at us as equal either. So we're coming into a space where we're dealing with this non-equal lens and having to navigate this world, and people want to provide us cookie cutter cis white solutions that aren't helpful because they don't speak to our experience. And I'm not saying disregard any of that, but it needs to be augmented based on our color, gender, and our lived experience. You can't just say this works for Chris and Sam Jones, so it's going to work for Andy Arias, because it doesn't, because my background, my experience, my upbringing was completely different. So yeah.
This Germán, I would add being thoughtful about our intersectionalities, about the oppressive history that, because of our multi-representational lives, carry throughout. That and there is a difference between the trauma, discrimination that we experience as people with disabilities, accompanied by the trauma, disregard, oppression by our cultural, land of origin, and other, identifiers that also accompany and add to the trauma.
Thank you, Germán. Oh, Janie, please.
I'm just gonna jump in with one more thing. Also keep in mind too, that people often have diverse access needs. So it's a great idea to have standard access accommodations within your research design, or access accommodations, but also to have a conversation with each participant about their individual needs and what they might need on an individual level. Because even if, like, I'm a power wheelchair user, but my needs would most likely be completely different than other power wheelchair users. You can't put us all in the same box. We might all need ramps, but we'll need different things too. So just be aware that, standard access accommodations such as sign language interpreting, wheelchair access, plain language, those are all great things to keep in mind. But you do have to have individual conversations with each of your participants to make sure that their access needs are being met.
Thank you all. So I want to give our panelists a time to also add more to this question if you would like, around how can disability pride be more visible within the public health research space? I know you all have spoke about representation, you all spoke about compensation and honoring the perspectives of persons with disabilities. Is there anything else you'd like to add in regards to how pride can be more visible?
I think we need to be more visible, period. I think the reality of it is through media, through research, through centers, right? Like one of the reasons I was so amped up about this particular group, because it was led by Teresa Nguyen and Jennifer, you, and I knew your guys' background, but I also knew your diverse perspectives on your lived experience and the community. I was so over having, again, that super hyper-focused white lens of, we want to bring you in and we want to hear from you, but it's not going to be led by you, kind of dialogue. And I think we need to push that envelope within diverse communities and say, no, there are Indigenous individuals, there are Asian individuals, there are Latinx individuals, there are Black individuals that need to be at the forefront of this work and need to be leading the work, not just in it in a committee or a group and saying that we've done it. Again, I pray for the day that we do not have to have the door opened for us by anyone else but us. And then I think equality will actually occur, is when that day happens and we're like, whoa, I opened my own door and I'm holding the door open for others like me, not someone held it open for me and then we're closing it and being siloed and being elitist. So that's just a little bit of that perspective.
Yeah, thanks, Andy. And we hope that we're opening the door within the CLEC. We're excited about the work we're doing here and excited to have all of you a part of it. So we want to make sure that we have some time for our Q&A. There's been some amazing questions coming through the chat and also our Q&A. Teresa, I'm wondering if you could share with us a question.
Yeah, so we have quite a bit of questions. Hopefully we'll have time for a few for the panelists. The first question for you all is, how do we create opportunities for disabled people of color to lead research when often they do not get the opportunities to be within research spaces like universities and are too often excluded? So anyone can take it.
I can jump in and start. So my first suggestion would be to reach out to collectives like this one. Reach out to organizations that are working with people of color with disabilities and make connections and do your research. Know who the community organizations that are out there, set up meet and greets with them, and make sure that you can provide information about your project and can share with them your project in the ways that you are meaningfully including people of color with disabilities in your research. And so my suggestion would just be to find organizations within your community, reach out to them and start making those connections. And first and foremost, make sure that your project is meaningfully including people of color with disabilities, even before you reach out to them. That's the first step, is to make sure that you're doing that and then reach out to them and see if you can make connections.
Thanks, Janie. And Andy, you're muted.
I'm muted, yes. Indeed, and social media are powerful tools. Now more than ever, disability groups are utilizing social media as a platform for voice. So if your project is looking for diverse researchers from a disability perspective with great qualifications, it's time to put that on Facebook, Instagram. I'm not going to mention the X, but others platforms that the disability community reaches out to. Even LinkedIn. There's so many people with disabilities that have LinkedIn profiles that are looking for consulting jobs and work. So it's about putting the word out and being intentional about it.
Thanks, Andy. All right, we might maybe have time for one more question. Here is a question. Given the very real threats to DEI practices across the country, and often even just having conversations about oppression and exploitation of marginalized folks, how can we implement this type of work in a political climate that seems so complacent in erasing and rewriting history?
Yes, Germán. I'm doing some work in the most southeast state of CODIS and it is a problem there to use some words. But as people with disabilities, concepts like inclusion have been around in our culture and our communities for decades. And now we're beginning to see that expand. So look to some of our definitions of how we use the EI, for example, may not be the mainstream. So defining what you mean by words, and if you're in those political environments, focusing on people with disabilities, and in the back of your activities, have a goal of intersectionality.
I completely agree with you in that regard. There's ways to work creatively around language when it comes to, you might not use diversity, equity, and inclusion all in one phrase. You might have to break it up a little bit. You might have to bring in different language, but also institutions and communities can never release those words, right? They can use them internally. And in those political environments where you're facing the backlash, you just don't put it on public facing documents, but within your organization, this is the T, this is what we're really doing. But anything public facing, we're just going to change marginalized to this instead. I did it all the time in the federal government, but it worked, and here we are. So that's my suggestion to you.
So many amazing questions, such a great discussion. I feel like we could keep it going all day, but we're limited on time. I want to thank our amazing, distinguished panelists, Andy, Janie, Germán, for you all's perspectives today. I also would like to note to our attendees that we'll be sharing recording, our presentation slides, as well as our panelist contact info. So you can continue to stay connected with them if you would like as well. I would like to also thank our interpreters. And if you have remaining questions, would like to stay connected with us, please feel free to email us at clequity@brandeis.edu. And if you would like to learn more about the Community Living Equity Center, if you'd like an opportunity to read the bios of all of our advisory committee members, including the 3 distinguished panelists that you heard of today, please visit our website at communitylivingequity.org. Thank you to our attendees, and we hope that you remain safe and healthy until we meet again. Thank you. Bye.
Bye.